This by itself is unprecedented in the second-line setting. If anything, we know very well there has been a lot of clinical trials that unfortunately did not really show any improvement in outcome in regard to different agents, to name few, Brivenib, to also name ADI-PEC20 that we just completed ourselves at Memorial, led that effort globally. And now Regorafenib comes out and shows that improved survival. Now, of course, the puzzling part is that this is a drug that looks or appears to the on a direct look as being something similar to sorafenib, but probably it's not. And I think the data is very real and something that we have to probably dissect further. The nice piece of data that was added on, and I hope there will be more data coming out because there are still very important key points that are still missing, but the nice piece of data that came out at ILCA in Vancouver is that the combined survival for the patients who are on sorafenib followed by the regorafenib, even though this is not a planned analysis, it has the caveats and the bells and whistles about not being a pre-planned analysis, but nonetheless it's suggestive of 24-month median survival. This is a number that we've never heard in HCC, especially in the advanced setting, which is kind of like even compares favorably to the current standards being for local therapy even. So definitely we are a little bit in a new uncharted land, but nonetheless at the same time quite exciting. Some of the data that I'm still very eager, like any of my colleagues, to really hear, and really I just would encourage the first author, Dr. Bruce, to kind of like come out with this data as soon as possible. But obviously we would like to know how long patients stayed on sorafenib, did they receive sorafenib in what setting, and also what was the time in between the transition from sorafenib to regorafenib versus placebo. This I think will complete the picture. I'm not doubting the data, it looks quite amazing and quite impressive, but it's a matter of just making the picture as complete as possible.